This year at ICML, we presented the results of the final analysis of the Rochop phase 3 trial. It was an international multi-center randomized phase 3 trial that compared Romidepsin plus CHOP versus CHOP in peripheral T-cell lymphoma patients in the first-line setting. The interim analysis was previously a report and had demonstrated that there was no difference in terms of outcome between the two arms. And this year, this is the final analysis, 5 years after last patient in, and we observed that there was still no difference between the two arms, with an exception for patients with a TFH-like PTCL after a central pathologic review, and those patients have a longer duration of response after Romidepsin CHOP, approximately 50 months, as compared to patients in the CHOP arm that have a progression-free survival of a median PFS of 24 months. So probably patients with a TFH lymphoma have a benefit from Romidepsin addition. We also have a special focus on relapse pattern and outcome after the first disease progression. Disappointingly, we observed that patients have a very poor prognosis after the first progression in a well-annotated cohort in the last decade. The treatments used at relapse are very diverse and heterogeneous and led to poor results with a median PFS after the first progression of 3 months and a median overall survival that did not reach 1 year. And there was no consensus about the best treatment option. There was no advantage of one or another when we compare the different salvage chemotherapy option. Maybe a small benefit for brentuximab vedotin addition in combination with salvage chemotherapy, but it was an exploratory analysis, and this finding should now be confirmed in other studies.